Hi, my name's Anthea Dallas. I'm trained as a GP and currently my role is as the Director of the Medicine Program at the University of Tasmania. I started my graduate certificate in education at the University of Melbourne in 2014, and then every year I came back to do the next part of the course. So I finished with a Masters of Clinical Education in 2016. I really love teaching. I love the theory and the sort of background information that sits around teaching. And I really wanted to explore that with the same rigour that I give to my other areas of clinical work. One of the things I really wanted was to meet with other like-minded people, people like me who loved education and had interesting ideas and stuff to share. And it was also helpful for me in terms of thinking about career progression. I really wanted to explore further opportunities to be a university general practice academic, and this was a way forward for me to manage that career progression for me. So I remember the feedback information being just really groundbreaking and mind-blowing for me. We had a whole day, I think, of a feedback workshop where we looked at the theory and the pedagogy around that. We had guest speakers, and then we did a whole lot of practice and simulation of giving feedback. Changed my life, changed the way that I teach and give feedback, and was really exciting for me. The guest speakers were fantastic. We'd have people come in from all sorts of different institutions to talk on their area of expertise, and that was this wonderful window into the world of academic medical education. I just loved it. The other thing that was great was some of the assignments. I know that sounds silly, but there was moments where the assignments just really turned the lights on for me. They were designed to help you reflect on your own teaching practice or something that was real for you, and then apply the theory to that. I just loved it. There were moments where I would sit down and I'd write an essay for my uni work, but I was reflecting on my actual teaching. And that was so great to be able to integrate those things, to think deeply about what I was doing in my everyday work. And then the lights would go on, and it was a really exciting time for me. The course gave me a language to understand the problems that I saw in my everyday teaching. It's given me frameworks and principles to apply to those problems that I still use now and continue to think about. It's, I think, given me a way of seeing the world with an educational lens, with a clinical education lens in my work. The other thing I think it's been helpful in is that it's a marker of intention to employers. That it's sort of taken me from the level of being an enthusiastic amateur clinician educator to someone who's has an intentional career direction into education. And it was helpful in terms of moving me into my current role, I think, and helps me to perform my current role more effectively.